tell me if I need to.
Good afternoon. My name is Stephanie, and I am here with Dr. Becky Lynn, a SLUCare OBGYN at SSM Health St. Mary's Hospital, who specializes in sexual problems in women and menopause. Today, we are putting the spotlight on women's health because, let's face it, many women don't focus on themselves enough. Let's change that by asking Dr. Lynn some questions today, and if you have a question, please post that in the comment section below. So, let's talk about what the number one question is that women ask you when you see them.
Well, when they're coming for their routine care, I think the number one question that they ask me at like an annual visit is, how often do I need a pap smear? How often do I need to come to the doctor? Only because the recommendations for pap smear screening have changed over time, and they change fairly frequently. I think since I've been practicing, they've maybe changed 4 times. And you don't need a pap smear every single year like we used to do in the past. And for a while it was every 2, every 3, every 5, so women are often confused as to how often they really need to come. But we still recommend that they come for a yearly annual exam. We might not necessarily do the pap smear screening. A pap is really a screening test for cervical cancer. It's not the actual exam with the speculum. So we still recommend that women come once a year so we can examine and make sure everything's doing okay, separate from the pap smear.
I guess some women are scared of that visit. Is there a reason to be scared?
There's really not a reason to be scared, but it's not the most comfortable of visits. So I think people think, oh, I don't need a pap, then I'm just going to delay that for as long as I can delay that. But somebody needs to do an exam and make sure everything looks okay. So and there's probably a percentage of people who are scared of it as well. But it shouldn't really be too scary. It's just not very comfortable.
What's the risk of not doing that every year?
Well, if you really don't go to the gynecologist or your primary care physician and have your pap smears, those are the women that end up with cervical cancer. Because the good news about cervical cancer is it can be caught very early with a pap smear. It's a very slowly progressive cancer. And women who don't go to get their paps are the ones that we end up seeing with cervical cancer. So that's one thing that's very important. The other thing is that women need a breast exam. So a mammogram is not a perfect test. It can miss up to 12 to 15% of cases of breast cancer. So we recommend that you have a clinical breast exam also. And I think women many times say, oh, I had my mammogram, so I don't need to go. But there's no test that is perfect, and mammograms can miss things.
Let's talk about warning signs that maybe you need to go see your OBGYN. Mm-hmm. What kind of things should women be looking for that's a sign like, oh, I need to make an appointment?
Mm-hmm. I would say irregular bleeding, where your periods aren't coming monthly. Maybe you have a period that lasts for a whole month, or you're bleeding heavily, you're lightheaded or dizzy. Anything that's not your normal monthly period, more or less. Many women are not exactly 28-day cycles. So irregular bleeding. Other things to look out for are if you notice a breast mass or skin changes in the breast, breast lumps, lymph nodes under your arm. That would be a reason to come in and have it checked out. There's a variety of things. If you notice like a lesion on the vulva that's not getting better, that's not going away, if you have unusual discharge, those are all really good reasons to visit your gynecologist.
Is there a rule, or does it change as a woman gets older, or how often they need to go? Is it just really stay that yearly visit?
It stays that yearly visit. Mm-hmm. Unless you're having problems, then we might see you sooner. But we recommend a yearly visit to the gynecologist.
Okay, let's talk about women and about menopause. What are the signs of menopause that maybe, and they can start as early as in their 40s, right?
Right. Mm-hmm. So the average age of menopause is 51, but the signs and symptoms start happening typically in your 40s. And women, even though the average age is 51, women can go through menopause in their early 40s, that would be pretty young, or their mid 40s or late 40s, or up to 55 or 58 or 59, and that's a little less common also. Most people are around that 51, 50, 52 age. The most common signs of menopause are irregular periods, where you start missing a couple periods, then you have a normal one, then you miss a couple, have a normal one. And some women in their 40s will end up with really irregular cycles that we need to treat and fix because they're bleeding all the time. So irregular bleeding in your 40s is sort of that precursor to the next steps of menopause. It's common for women to develop hot flashes where they feel really hot, they're fanning themselves, and all of a sudden they're shivering. And that happens right, in that time period, the perimenopause, before your periods stop. And then after your periods stop, people continue to have hot flashes. And how many years they last depends on the person. So there's no set, okay, by 2 years, your hot flashes are going to be gone. Some women will have them for 10 years, some women will have them for 2. The good news is we have a wide variety of treatments for hot flashes, things that are hormonal and things that are non-hormonal to treat hot flashes. And then the other thing that I think many women aren't aware of is once you go through menopause, which by the way is a whole year without a period, when your body's not making estrogen anymore and testosterone and those hormones, you develop vaginal dryness. And the vaginal dryness tends to show up a little bit later. So maybe 5 years or so after a woman's period has stopped. And that vaginal dryness can cause significant painful sex, or what we call dyspareunia. And because it's sort of a delayed symptom of menopause, many women aren't aware that it's due to the lack of hormones because of that time delay. But the same thing, there are some wonderful treatments, really good treatments, and you don't have to live with painful sex due to menopause. So
good for women to know.
It's great for women to know.
There's help out there.
There is help.
Let's end with, what is that one piece of advice that you have for busy women? Women seem to be so busy. Mm-hmm. What is that one piece of advice that you want to give them about their health?
I would say make sure you go to the doctor, because especially when women are busy and they're healthy, or they're young mothers or mothers, that they are so focusing on taking care of everybody else, but it's really, really important to take care of yourself and make sure that you are going, if you're healthy, at least yearly to the physician to get everything checked out. And I'm also a big believer in exercise. We all get so busy, we don't exercise. Exercise does so many wonderful things for your health. Helps prevent diabetes, maintain a healthy weight. It helps improve your moods. It helps with PMS, helps prevent heart disease. There are just so many reasons why we should exercise, and more than just walking at your office. I mean, getting to the gym, breaking a sweat, getting your heart rate up, there's so many benefits, and it improves your sex drive.
That's a good note to end on.
Yes.
All right, so if you have more questions, or if you'd like to make an appointment with an SSM Health physician today, visit ssmhealth.com. Dr. Lynn, thank you for your time.
You're welcome.